when I was first diagnosed with prostate cancer, obviously it's quite a shock to the system. Is there some strategies or something that would help people deal with the initial diagnosis?
Yeah, I mean, I think any sort of cancer diagnosis is a shock to most people, even if they might have an inkling. I think the confirmation is a shock to the system. And I think first of all, it's just to let everybody know that that's really normal, that there's going to be waves of emotions that come at different times, and you might have good and bad days. We call it a sort of adjustment cycle. And there's certain feelings that we expect people to go through, like denial and anger and anxiety and depression. And something that can be really helpful, especially in the initial phases in helping somebody to adjust, is to try and maintain a bit of a routine. Because there's familiarity with routine, and it helps to create some predictability at a time when you might not know what's coming next. You're waiting for answers and treatment options, but if you know kind of what your schedule might look like over the day, then that just takes a bit of pressure off.
Yeah.
And it can really help to calm your mind down. Um, Reaching out to people that you love and trust is always really important. And if that isn't something that feels comfortable, then perhaps speaking to your team, getting support from the CNSs, or even Macmillan as well, have some counselors available to talk to about that initial kind of shock. But if you don't already practice things like relaxation or mindfulness, then those are also some really good things to start trying as well.
Yeah.
It can feel a bit, I guess, fluffy at first if it's not kind of your usual way of managing emotions, but there's so much research that shows it really helps to not only sort of calm our minds, but our bodies down as well. And so the earlier that you start doing it, the better. So yeah, routines, talking to people, and just looking at different ways to try and help look after your feelings, because they're going to fluctuate throughout your whole journey.
Yeah, I know certainly at the point of my diagnosis, it was probably more the denial aspect that I went through. I was sort of like went into almost um, I don't know, an emergency mode that
Yeah.
I just almost went, right, okay, that's it. Let's just get on with it and get it sorted out.
Mhm.
Didn't really absorb what was going on, which later on in the process I suffered with basically.
Yeah.
So yeah, so I think the earlier you accept that this is happening and that you start to deal with it, then I think the better it is for your mental health.
Yeah, absolutely. I mean, the sooner you can start moving along that sort of adjustment, then it is better. And everybody does go through a period of denial and shock. And I talk to people I see on a regular basis about I don't like popping people's denial bubbles. It can actually be quite healthy and protective.
Right.
It gives you a bit of time to sort of mentally sort through what's happening for you. It's when it's going on for a long time that it stops being helpful and starts to get in the way of you adjusting. So yeah, a few days of being in shock, fine. If it's sort of ticking over into weeks and months, then that's more concerning. Yeah.